Hantavirus. The very word might sound unfamiliar, even a bit ominous, but for a virus that can cause serious illness, it's surprisingly common. Hantaviruses are a family of viruses found worldwide, primarily carried by rodents, especially deer mice. These tiny creatures often go unnoticed, their presence hidden in attics, basements, and woodpiles. But their droppings, saliva, and urine can harbor a silent danger: hantavirus. Unlike many viruses that spread through coughs and sneezes, hantavirus takes a more indirect route. It's not about person-to-person contact. Instead, it lurks in the shadows, waiting for an opportunity to jump from rodent to human. When we disturb their habitats, cleaning out sheds or exploring dusty corners, we unknowingly put ourselves at risk. The good news is that human-to-human transmission of hantavirus is extremely rare. The bad news: even a single encounter with contaminated rodent droppings can have serious consequences. That's why understanding hantavirus, its transmission, and its prevention is crucial for protecting ourselves and our loved ones. This essay will delve into the world of hantavirus, exploring its transmission, the symptoms of infection, and the steps we can take to minimize our risk. Knowledge is power, and when it comes to hantavirus, a little awareness can go a long way.
Welcome to our in-depth look at hantavirus. I'm your AI guide, here to help you understand this hidden threat. Let's dive in and learn how to protect ourselves and our loved ones. Hantavirus is carried by rodents and can infect humans. The virus resides in rodents without harming them. It's shed through their urine, droppings, and saliva. Humans get infected by inhaling contaminated particles. Disturbing droppings can make virus particles airborne. These particles can be inhaled, leading to infection. Understanding hantavirus transmission helps in prevention. Hantavirus infection can be a silent stalker, its early symptoms easily mistaken for other common illnesses. After an incubation period that can range from a few days to several weeks, the first signs of trouble begin to emerge: fever, chills, muscle aches, and headaches. These flu-like symptoms can easily be brushed aside, especially during cold and flu season. However, as the virus takes hold, the symptoms escalate. Nausea, vomiting, and abdominal pain may develop, accompanied by dizziness and fatigue. A persistent cough and shortness of breath can signal that the virus is affecting the respiratory system. One of the hallmarks of severe hantavirus infection is a condition known as hantavirus pulmonary syndrome, HPS. HPS is characterized by a rapid and severe onset of respiratory distress. Fluid builds up in the lungs, making it increasingly difficult to breathe. Blood pressure plummets and the body's organs begin to shut down. It's important to note that not everyone infected with hantavirus will develop HPS. Some individuals may experience mild or even no symptoms at all. However, for those who do develop severe illness, the consequences can be life-threatening. Recognizing the symptoms of hantavirus infection is crucial for early diagnosis and treatment. If you experience any of these symptoms, especially after potential exposure to rodents or their droppings, it's essential to seek medical attention immediately. Diagnosing hantavirus infection can be challenging, as its early symptoms mimic those of many other common illnesses. Doctors rely on a combination of factors to make an accurate diagnosis, including the patient's medical history, recent activities, and clinical presentation. A thorough medical history can reveal potential exposure to rodents. Questions about recent travel, outdoor activities, or cleaning out rodent-infested areas can provide valuable clues. Doctors will also inquire about the specific symptoms experienced, their duration, and severity. Physical examination focuses on assessing the patient's respiratory status, checking for signs of fluid in the lungs, and monitoring blood pressure. Laboratory tests play a crucial role in confirming the diagnosis. Blood tests can detect the presence of antibodies to hantavirus, indicating infection. However, it's important to note that antibodies may not be detectable in the early stages of infection. In such cases, doctors may order additional tests, such as polymerase chain reaction, PCR, which can detect the virus's genetic material in blood or tissue samples. Early diagnosis is crucial for effective hantavirus management. The sooner treatment begins, the better the chances of preventing severe complications. If you suspect you may have been exposed to hantavirus and are experiencing symptoms, don't hesitate to seek medical attention.
Section 5. Prevention is the best medicine, protecting yourself and your family.
Prevention is better than cure. Avoid contact with rodents and their droppings, seal cracks in your home and store firewood away from the house. Keep garbage sealed and maintain cleanliness. Wear gloves and a mask when cleaning rodent droppings. Use traps or baits if hantavirus is prevalent. Prevention is a shared responsibility. Protect your family and community.
Section 6. Navigating treatment, managing hantavirus infection.
Treating hantavirus infection can be complex, as there is no specific antiviral therapy available. Management primarily focuses on providing supportive care to alleviate symptoms and support the body's natural defenses. Hospitalization is often necessary, especially for individuals with severe symptoms, such as those with hantavirus pulmonary syndrome, or HPS. Patients with HPS require intensive care, including oxygen therapy to assist with breathing and mechanical ventilation in severe cases. Medications may be prescribed to manage fever, pain, and inflammation. Intravenous fluids are crucial for maintaining hydration, especially in patients experiencing vomiting or diarrhea. Close monitoring of vital signs including blood pressure, heart rate, and oxygen levels is essential. Early recognition and prompt medical attention are crucial for improving outcomes in hantavirus infection. While there is no cure, supportive care can help manage symptoms, prevent complications, and increase the chances of survival. Researchers continue to explore potential treatments for hantavirus, including antiviral drugs and immunotherapies. However, more research is needed to develop effective and readily available therapies.
Section 7. Real-world impact stories and statistics of hantavirus.
In the United States, hantavirus infection is relatively rare, with an average of 36 cases reported each year. However, it's important to remember that these numbers only represent reported cases. Many mild cases may go undiagnosed or unreported, making it difficult to estimate the true incidence of the virus. The Centers for Disease Control and Prevention, or CDC, has documented cases of hantavirus infection in 36 states, with the majority occurring in the western and southwestern regions of the country. Globally, hantavirus infections have been reported on every continent except Antarctica. One of the most well-known outbreaks of hantavirus in the United States occurred in 1993 in the Four Corners region where the states of Arizona, Colorado, New Mexico, and Utah meet. The outbreak caused a surge in cases of hantavirus pulmonary syndrome, with a high fatality rate. The outbreak was traced back to deer mice, whose populations had exploded due to favorable environmental conditions. The outbreak highlighted the importance of rodent control and public awareness in preventing hantavirus transmission.
Section 8. Staying informed, staying safe, resources and further information.
Knowledge is power, especially when it comes to protecting yourself and your loved ones from infectious diseases like hantavirus. Staying informed about the virus, its transmission, and prevention strategies is crucial for minimizing your risk. The Centers for Disease Control and Prevention, or CDC, is an invaluable resource for all things hantavirus. Their website provides comprehensive information on the virus, including symptoms, diagnosis, treatment, and prevention tips. You can also find region-specific information, including data on reported cases and areas where hantavirus is most prevalent. Your local health department is another excellent resource for information and guidance on hantavirus prevention. They can provide information on rodent control programs in your area and offer advice on how to make your home less inviting to rodents. If you work in an occupation that puts you at increased risk of hantavirus exposure, such as construction, farming, or forestry, talk to your employer about safety measures. They should provide training on hantavirus prevention and ensure that appropriate personal protective equipment is available.
Section 9. Conclusion, a call to action for hantavirus awareness.
Hantavirus, though relatively rare, poses a serious health threat, especially for those who live or work in areas where rodents are common. Understanding the virus, its transmission, and the steps we can take to prevent infection is paramount. By raising awareness about hantavirus, we can empower individuals to protect themselves and their communities. Simple measures, such as rodent-proofing our homes, maintaining a clean living environment, and taking precautions when working or recreating outdoors can significantly reduce the risk of infection. Let's not wait for another outbreak to remind us of the importance of hantavirus prevention. Let's make every day a day for hantavirus awareness. By working together, we can create a safer and healthier future for all.
Make sure to subscribe and tap the bell icon so you never miss out on our latest updates.